Good morning, everyone. Thank you for joining me for Friday Friends. I'm Deb Burton, and I am the founder and creator of RI Elder Info. RI Elder Info and RIElderInfo.com is the most comprehensive resource for seniors, caregivers, and professionals here in Rhode Island. And we are a 501c3. We are located here in Rhode Island. We bring Friday Friends to you each Friday at 9 a.m. to help spread the word about some amazing things that are going on right here in the Ocean State that people really need to know about. It wouldn't be possible, though, without our sponsors. And our sponsor for this week is the Visit Kit. It's an amazing program. Let me give you a few minutes of information on that.
Family and friends of people with dementia, we need your insight. We're introducing Visit, an activity kit and an app that helps you and your loved one have the most positive interactions. Take our survey at thevisitkit.com and help us deliver the very best solution. Thank you.
And I promise the survey is quick and you can do it anonymously, super easy. So this week, I am really excited to introduce to the world a couple of friends of mine. Terry Fogerty is the Community Outreach Coordinator for the Alzheimer's Disease and Memory Disorder Center over at Rhode Island Hospital. And Tang is the Outreach Manager over at the Memory and Aging Program over at Butler Hospital. Welcome, Terry and Tara.
Good morning. Thanks for having us. We're excited to be here today.
Good morning.
Thank you so much. So tell everyone what's going on in Rhode Island in relation to Alzheimer's and other related dementias.
Thanks for asking about that. There's so much going on right now. I don't even know where we would begin, but I do like to share with people that right now we are living in the golden age of Alzheimer's research, and Rhode Island is a big part of that. So what I mean by the golden age of Alzheimer's research is never in history has there been the breadth and depth of research that is going on not only a local level, but a national level and an international level. A lot of the puzzle pieces are starting to be put together by all these researchers throughout the world who are now sharing this information with each other. And studies that have been going on for sometimes close to a decade, with a study I'm thinking of right now called the ADNI-3 study that we're doing at our site, and Tara site at Butler is also doing. This is a historic imaging study of the brain that has provided a tremendous amount of information to researchers throughout the world in helping them really focus their research and target their research on ending Alzheimer's disease and dementia. And as I said, there is a lot of collaboration going on throughout the world. And here in Rhode Island, we have quite a bit going on. I think Tara can tell us a little bit more about that.
Absolutely. This is certainly unprecedented times, and collaboration is probably at its strongest that we've seen so far. Certainly our work with the Alzheimer's Association at the national level, as well as the local Rhode Island chapter in Massachusetts, New Hampshire. We have the U.S. Pointer study that we're conducting at our site, so we'll talk a bit more about that. But we also have our collaborations with our friends at Lifespan, so working with the Miriam Hospital, Rhode Island Hospital, where Terry is, Brown University, University of Rhode Island, and of course, all of our community partners that work with us to help spread the message and the education about Alzheimer's disease and the research that all the sites are conducting here in Rhode Island. So it really, truly is a collaborative effort to spread the word and to help people as best we can.
That's really cool that, a lot of times you hear about different organizations really fighting for funding and that kind of thing. And I think the collaboration here in Rhode Island is really unique. We see each other at a lot of the same venues. And, if someone doesn't maybe fit for Terry's program, do you refer her to, Terry, if somebody doesn't fit for your program, do you refer her to he or she to Terry's program?
Yes, absolutely. We also occasionally refer them to the Rhode Island Mood and Memory program here. So we have 3 research sites in the province area that are conducting Alzheimer's research, which is amazing in and of itself, considering the size of our state. So if I have someone call me up and I don't have a clinical trial or study that they're appropriate for, I might suggest that they contact Tara over at Butler, or my friend Annie over at Mood and Memory, to see if they have a study that they would qualify for. Also, in many cases, we find individuals, just yesterday, I sent someone over to Tara because they had already been working with Butler. And so the study that they were inquiring about, both ourselves and Butler are doing, but because Butler's been following them in clinical research, it was more appropriate to send that individual to Butler to consider participation in that study.
And it really is about finding like the right space for an individual and their family. So I think Terry echoes this, and that we want to make sure everyone finds the right home. So as long as they are finding the right space at either one of our places, then that's great.
So I think I hear a lot of, and I hear a lot of ageist rhetoric in the media these days. And there seems to be this misperception that as we get older, of course, we're going to forget things. Of course, we're going to have Alzheimer's. What's the reality, and when should people worry?
It's a great question, Deb. So you said, what we are hearing as we age, we're going to have memory and thinking issues. And I always tell people, because I always hear from people who call me up and say, I'm forgetting people's names, or I forgot a date. And I say, just as our bodies slow some as we age, so do our brains. One of the things that we need to think about is, in relation to your peers, the people you spend time with, are you seeing more issues with your memory and thinking than they are with theirs? And there's some things that I really like to stress when I talk to people about when to worry. The Rhode Island Alzheimer's Association has a great 10 warning signs for Alzheimer's disease. I really recommend people take a look at their site, alz.org, to see what those 10 warning signs are. But I like to parse them down to what I call Terry's top 3 things to be concerned about. And that is, if you are having problems with memory, the first thing I want to know is, are you having greater issues with your short-term memory versus your long-term memory? People with short-term memories are of particular concern. If you are forgetting, let's say, for instance, what you had for breakfast this morning when it's not even lunchtime, that's a concern. If you are forgetting what appointment you have today, that is a concern. So things that are in the short term, as opposed to, some of us can easily remember the name of our 3rd grade teacher. Those long-term memories stay around for a lot longer because they're better filed in the brain, I might say. So short-term memory concerns are the first thing we look for. Then frequency and severity. How often are you having these memory issues, and how much do they affect your activities of daily living? So if you're having these memory and thinking problems regularly, and they're starting to impact your daily living, meaning, I forgot about this appointment, and now I have to find some way to reschedule it consistently. I'm forgetting every time I go to the grocery store to get those basics that I always know that I have to get. These are things that we want to be concerned about. And the last thing in the top 3 is the change in personality. And that's something we see a lot in people who are having memory and thinking problems. And when I say that, people who are typically wallflowers, when they start having memory and thinking problems, may start becoming the life of the party. And conversely, those people who were so outgoing and engaged in life, we see more often that they start to withdraw. And we think that has a lot to do with some kind of self-knowledge that something isn't quite right anymore. And so they're not as comfortable engaging. So the three things that I always want people to be looking for are you having more problems with your short-term memory versus your long-term memory? Is this happening more frequently, and is it creating more disruption in your life? And then do you see any change in personality? I also want to say we're not the best judges of these situations. We often are in denial about these things. And people say, well, my spouse will tell me, or my partner will tell me, or my kids will tell me if they notice something wrong. Not always the case. I always say, find that good friend that you've had for a long time who's willing to say, you know what, Terry, something just doesn't seem right anymore. I'm a little bit concerned that you should get this checked out. And that's the next thing that we want you to do, is make sure that if you are having any kind of memory or thinking problems that are causing concern, that you bring that information to the PCP. Tara can probably say also that we find when we're talking to people who call up and say, I'd like to participate in clinical research, we ask if they have a diagnosis of a memory or thinking problem, and they'll say, I haven't even talked to my doctor about it. And it's really important that if you're seeing any signs of changes in your memory and thinking, you bring this to the attention of your primary care physician, because there are things other than dementias that can cause memory and thinking issues. And those are medical conditions that can easily be reversed. Things such as urinary tract infections are very frequent in women, and they can cause memory and thinking problems short term. As soon as you get on an antibiotic, it clears right up, and that strange blip in your memory and thinking has disappeared. Things like vitamin B12 deficiencies. Get vitamin B12, and that can help it. Medications, we see that a lot. Some medications that are prescribed can cause memory and thinking problems. So you want to be aware of that. Have I started a new medication lately? Could that be causing this confusion I'm having? So we could go into a lot. There's a lot of things we could talk to in regards to this, and I know our time is limited today. But one of the things that we wanted to talk to you about today, Deb, is prevention research that's going on. There's so much excitement around what's going on in prevention research. So, yeah, we're starting to change the conversation around Alzheimer's disease, and this has been pretty recent.
Yeah, and I think one of the things that people maybe have noticed during COVID is might see some mental health, depression and anxiety, and sometimes that can cause you to forget too, but it's still something that you want to have a conversation with your doctor about. The other thing that it seems COVID has brought to mind is people maybe are checking on their parents and really paying attention more closely to what is happening in the house. And I think sometimes what will happen is, like you were saying, ask a trusted friend, because those who are living with you and see you every day, they might not necessarily see changes that are taking place slowly over a period of time. But you all of a sudden, you can get out of the house and have a socially distanced cup of tea with your best friend. And now your best friend is saying, oh, wait a minute now, something's not right. I think sometimes having that gap period where you don't see someone and then they notice it, we really need to pay attention to that. I think a blessing that we have that we're here in Rhode Island is the research that's going on. So Tara, please tell us all the exciting things that are happening.
Sure, and I think Rhode Island is the right size for all the research that is going on right now, and there's a great community spirit here. So one of the big prevention studies that we have going on at the Butler Memory and Aging Program is the U.S. Pointer Study, and this is a landmark study that we started back in June, which is wonderful, and it is looking to test 2 different lifestyle interventions. So looking at exercise and healthy diet, mental and social activities and whatnot, and seeing if by making changes in those 2 realms, if it will improve your overall brain health. And hopefully what we're looking to find is that it will slow down or prevent the onset of Alzheimer's disease. What's great is that this is a short study in the grand scheme. It's only 2 years. So we're looking for people between the ages of 60 and 79 who do not have any cognitive decline at the moment, but are interested in participating, and there's no investigational medication. So if you were curious about doing research before, this might be a nice entry one because there is no investigational medication, and it is looking at two very important things so that could benefit not only your brain health, but also your heart health. So we need 400 people. So we are calling everyone in Rhode Island and southeastern New England to come and check this out. And if you have any questions, the outreach team here at Butler is more than happy to talk with you about that. So it's a really, really nice study, I think.
So 400 people.
Mm-hmm.
I know that's it. That means you might have to actually reach out to 1,000 people or more.
More.
Yeah.
So if people want to participate, where do they call? What do they do?
Sure.
What are the programs are out there?
Sure. So for the U.S. Pointer study, they can call us at 401-POINTER. They can also go to pointer@butler.org to email. And then if they just want to jump onto the our Butler Prevention Alzheimer's Registry, they can go to butler.org/ALZ registry. So all of those different ways you can jump on and find out if this would be a good program for you.
Awesome. And there we go. We have that up on the screen so people can find that number out and reach out to you. And Terry, how about your program? What research studies do you have cooking over there?
So first, we want to congratulate Butler on being one of 5 sites in the entire United States that is running the Pointer study, which is, as Tara said, a landmark study. And Lifespan, the Miriam Hospital and Rhode Island Hospital are happy to be part of that research study. It is really pivotal in research around lifestyle modifications. And as Tara said, that is not a drug-related study. It is an interventional study. Over at Rhode Island Hospital and also at Butler, we're doing a study called the AHEAD study of an anti-amyloid monoclonal antibody. So now I've just thrown a lot of information at you that is confusing for the best of us. So I'll just step back a minute here and say that we know that those people who die with Alzheimer's disease, we do autopsies of their brain and find what many people have heard of as the plaques and tangles of Alzheimer's disease, amyloid plaques and tau tangles. And we're looking at a medication called BAN2401. It's actually an anti-amyloid, meaning it's meant to clear out the amyloid in the brain. Monoclonal antibody, which is a man-made protein that acts as an antibody and fights that amyloid in the brain, removes it, and helps prevent it from reforming. So we're doing a study at our site for individuals ages 55 to 80 who may be at risk for developing Alzheimer's disease. And we're looking for healthy volunteers. Those who are between the ages of 55 and less than 65 will need to have a known risk factor for Alzheimer's disease. Meaning, do you have a first-degree relative, a mother, father, sister, or brother with Alzheimer's disease? Do you know if you have the ApoE4 risk gene? And we can talk, if we have time, more about how you can find out if you have that, and also what that means. And then the other thing is, have you had a PET scan of the brain and know that you have amyloid in it? Now, if you haven't had a PET scan and you're anybody who's participating in this study will have a PET scan as part of the screening process for the study. And you will have to have a certain level of amyloid plaque in your brain to participate in this study. It is just over 4.5 years in length, and it is an IV infusion, meaning you'll receive this monoclonal antibody through an IV catheter that goes into your arm. And it will be delivered every 2 weeks for the first 96 weeks of the study. And then depending on your amyloid level, you either continue every 2 weeks for the remainder of the 4 years, or if you're at a lower level of amyloid, you would then go to once a month for the remainder of it. The good thing about this study, and Tara and I are always excited when there are long-term extensions, or also known as open label extensions on this, because this is a placebo-controlled, meaning you have a 50-50 chance of getting the study drug or a placebo, and a double-blind study, meaning we don't know whether you're on this placebo or the actual study drug, nor will you know that. At the end of the study period, individuals will be given the opportunity, regardless of whether they were on placebo or the study drug itself, to continue on to the study drug at the end of that 4.5-year study. So that's exciting.
And I think both of us, I'm sorry.
You're muted, Deb.
We were just talking about that. Yes, I muted myself. Yes, Judy Fortier was just saying that she's learning a lot from this, so that's great. So when you guys are conducting science, or your teams are conducting science, are there rigid protocols, like rules you have to follow? Like you can't just make stuff up?
Oh, we make stuff up all the time, don't we, Tara?
Now, all of the studies do have a set of inclusion and exclusion criteria that are set forth in the protocol, which is basically the rule book for the study. So we do have to follow those. And that's why it's really important to make sure that we have a person's complete health information and doing a complete assessment of the individual, whole person, not just what's on paper, but how everything is going overall. Because all of those could be factors in a reason why someone may have some memory loss. So it is definitely important that we have the full picture, the accurate picture, so that we can suggest different research or different options for families and their loved ones so that they can get the best care.
Yeah, safety is always our #1 priority. We are diligent about making sure that there are no concerns about the study medication disrupting any kind of medical or health condition an individual has, or putting them at risk at any point. And that is continually monitored throughout clinical trials. And one of the really exciting things I think Tara and I talk about all the time is how much care people involved in clinical trials receive as part of being in a study. You're monitored regularly throughout that entire study period, and not just your cognitive health, but also your physical health throughout. And, I've heard many instances where people have gone for these brain scans and have found other conditions that are emergent and need serious attention. But for having gone to participate in this clinical trial, they may not have known about it, and in some cases may not have known about it in time. And I'm talking specifically about, potential aneurysms or leakage in the brain that could end up with serious concerns. So your heart is monitored throughout this, so that if there is a heart problem, we would bring that to your attention too. There's a lot of added benefits to participating in clinical research. These screens to participate in clinical research, you're getting about $10,000 plus worth of value of medical screening when you're participating in these PET scans that we do as part of this AHEAD study. Those can cost thousands and thousands of dollars if you were to just do that through your general PCP, your insurance. That's the other thing we should let everybody know, Tara, right? There is no cost to participation in research to the individual or the insurance. So all of this is paid for by the sponsor of the study.
Exactly. And this is also giving you an opportunity to perhaps be on that cutting edge and be potentially receiving something that is going to help you ahead of the general public. As we all know, these clinical research takes quite some time to conduct, to do it safely, to make sure that everyone is embraced in this. And so it takes time. So you might be able to receive something that's going to help you sooner, which is really nice as well. But absolutely, safety is important, and getting that whole care.
And so I think sometimes one of the things that people worry about when it comes to research studies are, am I going to get poked and prodded? Is anything going to hurt? Does a PET scan hurt? I don't know what that looks like. Like, you taking a bunch of blood? Are you asking me questions? Do I have to do something? How invasive and interruptive of my life is this going to be? And is it going to hurt? We have like these crazy ideas of what research looks like. And I don't know that everybody understands that human research on people isn't like what you see maybe in high-tech labs.
Yeah, I think part of the whole clinical research process, and one of the first things we have to do is go through an informed consent. It's incredibly detailed. And so that outlines exactly everything that is going to be undergone and what is going to be asked of an individual. So you can have that opportunity to speak with the clinical team and understand, how many blood draws am I going to have? What is the time involved in a PET scan or an MRI? What could that be like? And we can discuss, are you claustrophobic? Because if you really, really are, then maybe this study isn't the right fit. And that's what we were talking about earlier. You want to make sure you find the right fit for an individual. And so if, PET scans and MRIs are not your thing, then we need to take a look at something else that doesn't involve that. But I mean, we can absolutely have all of those conversations well ahead of time to make sure an individual and their families are comfortable with all the different procedures, and explain exactly how long it's going to take, what it could feel like, how often your visits are going to be to a particular site. So it's very, very comprehensive. And so we hope to answer all of your questions before we even go into any sort of medical procedure.
And so something that I was going to say, something that we want everyone to know is you are never obligated to continue forward with the study at any point. You could come in for screening and go to the first screening appointment, get your first MRI, PET scan, and say, you know what, I've changed my mind. I don't want to do this. You could be halfway through the study and say, something has happened in my life and this is no longer feasible for me to do this. COVID, we've had some patients who said, due to the COVID pandemic, I'm not comfortable coming into your site. Now, most of them, we were able to make arrangements through the sponsor to delay study visits, but there were a few who decided as a result of COVID, very few, that they just were not able to continue in the study. And there is never a consequence to that. We're always grateful for anyone's participation at any point. And again, it is free will. It's always your free will to participate, and there are no consequences to just declining continued participation.
So Heidi Ross had an interesting question. She wanted to know, how many languages are these tests available in? I have read that Alzheimer's and other related dementias impact different populations differently. So how do you try to bring in individuals who are perhaps different races, ethnicities, the different languages spoken? We want to make sure that, research that's put out is inclusive of all people, not just a handful of people who may look alike.
Sure, and I'm so happy you brought that up, Deb. That is something incredibly important in research in general, not just within Alzheimer's disease, but across the medical field. It's incredibly important, if we're going to find a breakthrough treatment for Alzheimer's disease, that we need to include everyone. In particular, the Latino population and the African American and Black communities are adversely affected by this disease. It is, for Latinos, it's 1.5 times more likely. Within African American and Black communities, it's twice as more likely as compared to their Caucasian counterparts to develop Alzheimer's disease. And they are also the individuals that are seeing more of this in their community. So it's incredibly important to participate, to come to the table, to learn more about it. If you have questions, if you have concerns, both Terry and myself are more than happy to discuss those with you. If those individuals are underrepresented in research, the breakthrough treatments that are found will not be doing their job, and that they're not reaching everyone. To answer Ms. Ross's question, some of the tests are able to be done in a different language. I know certainly Spanish and Cape Verdean are something that are important in Rhode Island. So there's also translating services. Some of the tests just would have to be a little bit more specific to a language, and that's for some studies that could take a little bit more time, but I believe that they are available. So, but absolutely, making it accessible to everyone is incredibly important.
Yeah, I think that I just wanted to jump on the back of that statement. You know, we're in the middle of the COVID pandemic and talking about the vaccine for this pandemic. And I think more than anything, people realize we've talked about the African-American population, the Black population being severely impacted by COVID. So it's so important for them and for everybody in this world to find what works, not just in the US, but in China, in Africa, in all of these countries. So if we don't have people representing those populations, then we end up with a drug that may only be effective for a percentage of the population. And we need these drugs to be effective for 100% of the world population, especially in dementia. I mean, 50 million people worldwide are living with this disease right now. So it's really important that we find representation from other communities. And it's really important researchers find new ways to outreach. It's a hard nut to crack, and also provide research opportunities in the languages that people are comfortable with. And that's something that we know and is being worked on at many different levels in the research community.
And so, Deb, actually, that the U.S. pointer study is based on the worldwide finger study. And so we have this study here in the U.S., but it's also in pretty much every continent at this point. So it's looking at language, it's looking at diet in a particular culture. So it's really looking at the holistic person and a culture and a group of individuals, how they eat, how they exercise, what's going to work culturally, and being culturally sensitive to that. And, you know, that's a wonderful thing. I'm so happy to be working with the Miriam on this study specifically for that. And this study is mandating that we have a certain percentage of participants who are of various ethnic backgrounds and cultural backgrounds. So I think it's fantastic that we're seeing more of that demand. And so we really hope that Rhode Islanders and really all of New England specifically for this study and the AHEAD study will join us in this effort, because we really do want to have everyone involved. It's such a great program. I think that everyone can get involved in fairly easily.
That's awesome. And so I wanted to just make sure if people wanted to participate, they could reach out to Butler.
Right. For the U.S. pointer study and the AHEAD study, if you want to reach out to us, we are at 401-455-6402, or you can reach us at butler.org/ALZ registry to find out if any of the research that we're conducting would be appropriate for you and your family.
Y Tara, tú hablas español, ¿no?
Sí, yo hablo español. Yo soy una persona aquí, hay 2 o 3 más personas que hablan español, pero soy la única persona que habla español en el equipo de outreach.
Excellent. You want to say it in Spanish, how to reach people, in case we have friends out there who have friends who have only speaking Spanish?
Sí, claro. Ustedes pueden llamar al equipo de outreach at Butler Hospital a 401-455-6402, o mandar un email a nosotros a memory@butler.com. And the website is butler.org/ALZ registry at REGISTRY. Got me, Deb. We have to go through the alphabet today. Pero gracias, por favor, llama a nosotros y podemos ayudarle.
Muchas gracias, señora. And Terry, do you speak other languages too?
No, un poco español, not muy mal. So,
that's
you can
okay.
reach us at the Rhode Island Alzheimer's Disease Prevention Center at 401-444-0085 or memory@lifespan.org. I'm always happy to talk to anybody. And I have had people call me about the pointer study, and I have that information for them so I can refer them over. So as Tara and I often say, we don't care who you call, just call and get involved in Alzheimer's research. Such an exciting time right now. We're starting, as I said earlier, to change the conversation. Deb, when I started in this about 6 years ago, it was all about finding the cure, the magic pill, that one shot that was going to stop this disease. Now we know that that's probably never going to be the case. We're starting to talk about treatment of Alzheimer's disease, and that's going to be multi-pronged and probably a very personalized approach to Alzheimer's disease treatment, meaning you may do anti-amyloids, anti-taus, existing Alzheimer's medications, coming Alzheimer's medications, and lifestyle interventions as kind of this Alzheimer's cocktail to help you manage this disease. And hopefully we'll change the conversation from this being a terminal disease very shortly to being a chronic disease like diabetes or heart disease or any of those other diseases that people can manage by using multi-pronged approaches to care and treatment. So we're really excited about all that's going on in research right now. I could talk to you about forever about all the exciting things that are happening. One of the things that's really exciting that just came out of the International AAIC conference is a blood test for Alzheimer's disease, which will be a huge game changer. And we expect that in the next couple of years. You'll be going to your doctor's office and part of your regular blood test will include a panel for Alzheimer's disease to see. Because we know that Alzheimer's disease starts about 20 years before you see those first signs or symptoms. So imagine if early, before you show any signs or symptoms, we know that you're carrying that disease and we start treating it then so that it never occurs, or at least it doesn't occur till far in the future. Such an exciting time.
That's
Exactly.
awesome.
And to that point as well, we also have research going on in the state that's looking at eyes, looking at retinal imaging, and that's using a machine that is already found in your eye doctor's office. So again, less invasive, more affordable. So there's many options that are coming out right now that we're hoping that Rhode Islanders and everyone around will be able to take advantage of.
This is
And we'd
great.
be oh, sorry. I was going to say we'd be really remiss if we didn't talk about the independent research going on here in the state of Rhode Island at Butler, at our site at Rhode Island Hospital, at Brown University, at URI. There's so much research going on into this disease right now, and also the social aspect of this disease. So there's research going on at our site by our neuropsychology team on caregiver stress. They're trying to develop a caregiver app that can help individuals manage the daily living situation when caring for someone with this disease and related dementias. So again, the breadth and depth, if I go back to that beginning of the conversation, the breadth and depth of research right now is astounding. And it's so much creating that idea of hope. I'm looking at the Rhode Island Elder with the anchor, which reminds us about Rhode Island's motto, which is hope. And I don't think we've had more hope than we have right now as far as ending Alzheimer's disease and related dementias. So we're very excited and we're very lucky to be working in this field at this time.
That's a great spot to end, because I think that there are so many hopeful, positive advances that are happening here in Rhode Island. It's great to see that, Rhode Island is charging ahead and really doing a lot of work. I'm really glad that you were both able to come on today and talk about your programs. I really hope that people just, call, have your family members call, have your friends call, find out, if you can participate. You need healthy people too, as comparisons, right?
Yes. Yeah. Well, yes, we do. We definitely want to get people involved in this prevention research because we think this is really key. Once we have that blood test, we want to be able to use these preventative measures through the Pointer study, through the AHEAD study, through previous studies such as the Generation study that really will be impactful on keeping people or delaying people from developing this disease.
And you don't have to call us you don't have to have memory problems to call us, right? And that's we take everyone in that regard.
Yes.
You know, we want to speak with everyone. And just as Terry said, everything can form 20 years beforehand. So the sooner the better. Just like every other health ailment that we have at the moment, prevention is best.
And get involved in our registries. We both have registries at our sites. You can belong to both of them.
Yes.
We'll both send you information. We'll both make you aware of opportunities. Again, because we do independent research projects, what I have at my site might not be the same as what Tara's offering at her site at the particular time. We do have overlap on some studies, but in some cases, Butler will be doing a study that we're not doing, or will be doing a study that they're not doing. And then there's always our friends at Mood and Memory. I don't want to leave them out either. We also include Mood and Memory as far as, you know, making sure if somebody's interested in research, we do due diligence to see if there's anything available in Rhode Island for them to participate in, because we need all hands on deck. We're the ocean state. Let's get all hands on deck.
This has been great, ladies. Thank you so much for joining me today. I
Thank
really
you, Deb.
appreciate it.
So much for having us. Such a pleasure to be with you both this morning.
Yes, always fun to work with y'all.
Thank you. Well, everyone, I hope that you have liked and shared our videos, so that way you are always staying up to date with what's going on out there and the resources that are available. Have to give a shout out to, of course, our sponsors, The Visit and The Visit Kit. Really important that you go on their website and take their survey. It's super quick. It's super easy. I do want to bring to your attention, coming on October 1st is the RI Elder Info Virtual Senior Resource Fair. If you can see me now, you'll be able to see the Senior Resource Fair. It's going to be live streaming right here on Facebook. We are very grateful to Oak Street Health for being our presenting sponsor on that. And we're happy to also have Elder Resources of Rhode Island and Independent Benefit Solutions as our premier sponsor and break sponsor. We also have Oakley Home Access and Anchor Bay and Tamarisk Assisted Living. We are really grateful. It would not be possible to bring you this information without our sponsors. So I hope that you have liked. I hope you have shared. Feel free to visit rielderinfo.com if you need more information. There's tons of resources on there. Sign up for our newsletter. I never spam people and I don't sell the information because that's just yucky and why bother? So I appreciate everyone joining me today. Thank you very much. And I look forward to seeing you all and your friends next week. Thank you.
Family and friends of people with dementia, we need your insight. We're introducing Visit, an activity kit and an app that helps you and your loved one have the most positive interactions. Take our survey at thevisitkit.com and help us deliver the very best solution. Thank you.